analysis of over 18,000 HIV nucleotide sequences, we found that transmitted resistance to HIV drugs is holding steady overall at roughly 16%. That's 1 out of 6 patients. From 2007 to 2010, we found that this increase was driven by 5% annual increase in resistance to NNRTIs. Now, to better understand the public health implications of this, additional studies are needed, but suffice to say that we recommend two things, that we have two important messages to get out, and one is that providers continue to conduct genotype testing for their HIV infected patients, and that CDC, for its part, will continue to monitor the transmitted drug resistance and drug resistance overall to HIV medications in the United States. Oh, that's a good question. Within the confines of the overall transmitted drug resistance associated mutations, we found that the increase was not statistically significant overall. However, when we looked at the NNRTIs, just to reiterate, that increase was significant. And the question is whether that's because the other transmitted drug resistance mutations to other drug classes, whether it's because they're going down. When we looked at the absolute numbers, no, the rise, there was a rise in PI associated transmitted drug resistance. That also went up, but that was not statistically significant, and the same goes for NRTIs. So the overall absolute percentages that are going up seems to be holding it going up a bit, but the NNRTIs the percentages was actually going up at a statistically significant pace.